Okay. So I have a 26-year-old autistic son, and from the time he was young, we understood he had very severe auditory processing issues. That's probably, I think, is his biggest challenge. What it's less in the well, no, it also sound sensitivity, but also the inability to understand spoken language, to follow conversations, definitely missing parts of words, inability to sit in a group and filter sounds and follow conversation, minimal verbal skills, a really serious language impairment. And I think that most of it came from the fact that he wasn't hearing properly. Actually, when he was in the second grade, he started to communicate better because he learned how to read. And then what he couldn't hear verbally, he would read, and then he would be able to make more sense of things. So it was really important that he acquired reading skills. And so we did auditory integration training with him when he was younger, and it helped a bit, and all different kinds of programs, auditory training. But I really felt that he was more reading lips and focusing on body language and writing. We actually started following, found that when we wrote with him, particularly on WhatsApp and things like that, in recent years, he communicated much better than he did by speech and following auditory conversations. So a while back, I found Dr. A's website, actually, because after a little bit after I started spoken to you, a little after I published my book, I started looking around online to meet people who were working there, because I do talk about all the different types of sensory processing in my book. And I found Dr. Ray, and we hooked up and we spoke. And I guess about 6 months, it was in the summer, that I decided. I was sitting with my son, and my other son had a group of friends sitting there, and they were all following a conversation, and I just saw how incredibly painful it was, because he just, no matter what we tried to do, he couldn't follow a conversation. He was sitting at the table wanting to participate, and everyone was saying different things, and he started to talk at the beginning, and then he just sat there and spaced out, and then in the middle he blurted out all different kinds of things that had popped into his head because he couldn't follow the conversation, even though the things were not relevant to the conversation. So it caused all kinds of social challenges as well. And so I reached out again to Dr. Ray and said to her, I live in Israel. I don't know what we can do to help my son. And she suggested that we look for a provider here. And she very, very generously said she would help train any provider that could help us out here in Israel, if necessary, in order to try Lgha hearing aids with him. So I actually approached quite a few of them around where I lived, and no one actually knew what I was talking about. And they had no idea. They looked at his hearing test and they said, "Oh, he's got normal hearing." No, it's not normal hearing. It's in the normal range, but he doesn't have a clue what we're saying, and his bearer is a little bit slow. He's processing he's picking up things slower than the average person, but this is not functional hearing. It may be in the normal range, but it's certainly not functional hearing in any way, shape, or form. Actually, so we spoke, and then I did some more searching, and there's only 2 places in the country that actually know how to test for auditory processing issues. One of them is the Tel Aviv Hospital, and was the Hadassah Hospital. So I called the place where he was tested for an APD, and fortunately, there's a Canadian audiologist who had heard about Lgha hearing aids, and she was able to program them for him. And so in July, he got his hearing aids, and his whole life changed completely. It's just incredible. First thing, he doesn't move without them. He, gets up. The first thing he does is he puts them in, and it has helped him in every aspect of his communication and life. He also processes language much faster, I found. He doesn't have that kind of delay before answering. Sometimes it would take him up to a minute to answer a question, I guess, because it took him so long to understand the verbal input and then try and process and then coordinate his mouth. And it was such a difficult process for him. It would take him a really long time to answer, which would cause a lot of problems for him because a lot of times people would wait a little while and then think he didn't understand and ask him something else or do something else and give up. So now he ask him a question and he actually answers it. Oftentimes he would actually repeat it back as well immediately, some echolalia, which has decreased significantly since he has his hearing aids, which is also incredible. And he can sit at at a table and participate in a conversation and not blurt out things in the middle that aren't connected or not look like he's not getting it or see the pain in his eye because he's trying so hard. He doesn't start yawning after 2 minutes. And he works in a coffee shop. He's washing dishes. And so not far away, there's the counter where they make the sandwiches. And his boss would never, until he got his hearing aids, his boss wouldn't be able to communicate with him from where the counter was and where he was in the kitchen because he wouldn't understand anything he said. He would have to approach him and look him in the face and read his lips. And I asked his boss about a couple of weeks after he got his hearing aids if he sees any difference. He says, yes, I can now talk to him from the counter when I'm working, and he understands what I'm saying from his face. So it's really miraculous. It's changed his life completely. He's much calmer. And the other thing he would do is make quite a bit of auditory stimming. So he would make a lot of noise. I would hear him, squeaking all the time and just lots of noise. I don't know if it was to reduce hypersensitivity from the sounds, cut out the sounds, or he was, I don't know exactly why he was making the noises, but since he has his hearing aids, the amount of squeaking and noises he makes also gone down significantly. And I asked him one day, I noticed he was making noise, and I asked him what was going on, and he said, "Bring me my hearing aids." And I said, "Oh, you didn't put them in, you forgot your hearing aids." So he put them in. I asked him if the hearings, when he wears hearings, he doesn't need to make those noises. And he said, "Yeah, they help me. I don't need to make the noise." He doesn't have lots of descriptive language to explain to me what he's feeling and why he does what he does. So I can get that answer from him. But the only thing he tells me is his hearing aids are good and he likes them and he wants to wear them, and he really doesn't move without them. So I can say that if anyone is thinking or questioning about whether to try, yes, definitely. It can turn your child's life or your life around 180 degrees. And we had been trying for years, like I said, all different things. We use a live listen feature on an iPhone, which you would give the iPhone to people when they were talking in a class or in a lecture, and he would put an earphone in his ear. We tried all different kinds of things, and nothing really helped that much. It was just like a partial solution. Once he got his hearing aids, that's when we started to see things turn around. And his language he's talking much more and talking much clearer because I think he's hearing and he's not so busy with processing and deciphering, so he can actually focus on the conversation and participate in the conversation. So it's been really incredible, the change that we've seen. And I can't even tell you how thankful I am to Dr. Ray. And I really strongly recommend anyone that's considering learning about that or trying. The audiologists here also said, we never know what's going to happen if you try these things, but it's worth a try. Worst case scenario, it doesn't help. Best case scenario, life can turn around completely. And I my understanding of language and cognition and neurological development is once you set the base down, you never know where it's going to go. So he's just started hearing now, but he hasn't been hearing in years. I imagine another year, 2, 3, 5, we're going to see the benefits of hearing because his language is developing and therefore his communication skills are developing and his neuronal connections in the brain are developing, and the sky's the limit. So